here's how I got exposed to what we're calling a CAM. I grew up in New York City and went to the State University of New York, graduated in pre-med and biology. And at the end of my studies there was a rumor going around that there was something west of Jersey. So this is 1976, and I got a van, and I went cross-country on an open-ended trip. I had no necessary endpoint. So we wandered around for 17,000 miles before I hit the Pacific Ocean in La Jolla, California. Then I made a right turn. Next thing I know, I'm in Oregon. Now, this is absolutely true. All day I said, La Jolla, La Jolla, La Jolla. Nobody said anything. 5 minutes across the border in Oregon, I was told. Oregon. I was in Alaska recently. A lot of Indian names up there. I didn't want to offend anybody, so as soon as I got into town, I went into a restaurant. I said, can you specifically pronounce where I am? The lady said, sure. Burger King. But Oregon was a different place than anything I've experienced. It seemed like one giant park to me, basically, which was nice, except at nights, because then I would get nervous because muggers live in parks. But while I was here, I heard about a type of physician that I never heard of before called a naturopath. Now, I thought that was a trail in a national forest. What I subsequently learned is naturopath goes to 4-year medical school. Back then, the only one was here in Portland. Now you have Bastyr in Seattle. You've got Bridgeport. You've got Southwest College. There's a new one in Chicago. There's 3 in Canada. And you're trained in all the same diagnostics and sciences, but when it comes to getting therapeutic, you're going to be required to take 2 years of clinical nutrition. You're going to be required to take botanical medicine, homeopathic medicine, Chinese medicine. And when all is said and done, you're licensed by the state as a general practice primary care physician. Now, I had never heard of this before, and as a New Yorker, I thought I knew everything. But I toured the school, and there was something that really struck me, and that was the level of presence of being of everybody I met in that program. The degree of eye contact, degree of here now, and it was very clear to me that whatever I thought I knew, I did not, and there was something very real here. Well, synchronistically, I had all the requirements. I had graduated pre-med anyway. They told me they have one space in the class that's open because they just found out somebody's not showing up and classes start next week. But there was a catch to this plan. Nothing's that easy. I had to drive to Wichita, Kansas. Not as a test of faith, but they had a Midwest branch, and that's where they had space. So about 3 or 4 days later, I arrive in Kansas, and now I'm having second thoughts about everything. Because A, I had never heard of this before, and B, no offense to Kansas, but as a New Yorker in Kansas for the very first time, I thought the zip code was EIEIO. And if I order espresso, I get my coffee faster. So, I'm in this class checking out Dr. Hulbert, and he starts like this. All right, future physicians, we're going to begin this year off very practical, very holistic, and a very natural treatment for body lice. Body lice, it works very good with children. You douse a child in 100 proof pure alcohol, then you roll the child in pure sand. The theory is the lice will get drunk, throw rocks at each other, and fall off. And I said, where did I park? But I never forgot what he did next, because if you laugh, you remember things. He draws 2 people on the board, and he says, what you now see before you are the 2 kinds of disease we have in the world. We have horizontal disease, we have vertical disease. Now, in horizontal disease, a person doesn't function. Heart attack, horizontal. Bad flu, horizontal. And the good thing about horizontal is it definitely gets your attention. You got to do something about it. Vertical disease is a different story. You know, people change their diets and symptoms they've taken for granted for 10 years are suddenly gone. Somebody can have arthritis, feel miserable, but they're functional. Metabolic syndrome, high blood pressure. That's all vertical disease. And pretty much all disease is vertical, before it'll go horizontal, except in trauma, which is not disease, it's trauma. And the goal of naturopathic medicine is take people from wherever they are, whether it's horizontal or vertical, and go to optimal health, quality of life. How good can you feel? How much energy can you have? Well, the second thing he showed us is a right triangle. And he says what you do is you make the length of the hypotenuse your health line. So the longer that line is, the healthier you are. So class, how do we make a hypotenuse of a right triangle longer? Well, we increase either the length of the baseline or the length of the height. Okay, my math teacher was right. That would come in handy somewhere. However, the base of our health triangle is genetic. At this point, that's fixed. We all bring to the world strengths and weaknesses. Eyesight is an obvious example, but this is true in all our organ systems. This is true in our biochemistry. This is even true at a whole other level. How many of you have children? Okay, did you notice that your kids came into the world with an attitude? They're different before you mess with their heads. Now what's going to happen is some people are going to bring in so much genetic strength on so many levels, they're going to have a pretty significant degree of health no matter what else they choose to do. George Burns, I would venture to guess, brought in a lot. George Burns lived to be 100, totally functional, smoked 18 cigars every day and 2 martinis. When asked, and what do your doctors say about that? He said, what can they say? They're all dead. But we do make choices, and that's what the height of our triangle represents. We make choices about what we eat. Back in 1976, that was a radical concept that mattered at all. Activity level. Exercise certainly is good for us. Environment, where we live, what we breathe. Okay, so I stayed in school, did a residency, and so 5 years later, I'm in private practice, and I've got this hopeless case. Here's a lady who's had arthritis for 15 years. She's tried everything I'd ever heard of, whether it was traditional or alternative. Nothing has really worked. And I had just attended a lecture from a medical doctor who was the head of OBGYN at St. Vincent's Hospital. And he came to talk to us because his colleagues thought he was crazy, because he was doing counseling with people before he'd go into surgery. And he told us that the symptom is a metaphor for whatever's going on. So if somebody has uterine bleeding, you should ask them, if those were teardrops, what do you think you'd be crying about? So I figure, well, you know, nothing else has worked. What do I got to lose? I'll pry into her life. Well, they didn't pry. Friends pry, health professionals probe. What I find out is her husband works for the federal government. So he's flying back and forth to Washington, D.C. each week. She's hated that job for 20 years, hasn't expressed it because she wants to support him. When minor upsets would occur, she wouldn't deal with it because they only had 2 days together. So she would suppress that. He was supposed to take an early retirement. She was looking forward to that. He decided against that. She suppressed her feelings about that too. Now, if you suppress too much with somebody you care about, it's going to build up a barrier between the two of you. My entire prescription to her was to teach her how you share upset without the other person feeling attacked. And when she did this, 30 days later, symptoms were gone. And they stayed gone. And I got what's known in the medical business as a major case of trout mouth, when you look like this. Next thing I know, I'm counseling more and more people. My practice becomes all mind-body medicine, referred by other physicians, people who have tried everything. So in a way, that was very easy for me, because I had nothing to lose. The worst I could do is like what everybody else did, which is not be able to help somebody. But I realized the blinding flash of the obvious. Of course it counts what we eat, but there is certainly more to us than our physical body. Nourishment on a mental and emotional level will be self-esteem, how good you feel about yourself. That will determine how you take care of yourself physically. Activity isn't just exercise, it's going to be the degree of control you feel over life. Is life tied to a horse, drag wherever it goes, or you ride in the horse direction you want to go? The degree to which we fulfill values and goals that are important to us is the degree to which we have health at this level. You know, I remember I had another patient come in and he was depressed. He'd been through 2 years of psychoanalysis. At the end of the 2 years of analysis, the analysis was, you're depressed. That's what I came in for. I knew that. So here, take this pill. So now he's more depressed because the antidepressants aren't really working. And what he didn't realize is he was violating a personal value of health by being on medication. So I ask about his past. He says filled with failure. I ask about his present. He said dead-end job going nowhere. I ask about what he thinks about the future. He says more of the same. Pretty depressing, huh? Here's a quick tip to bum yourself out just in case you ever get too happy. Pick something in your present that you hate. See it keep going in the future. Well, I clarified his values. We all have values within us. These are principles by which we live. Very often we're unconscious of our values because we as human beings can only pay attention to 7, give or take, 2 things at any one time. Consciously, research was done in the mid-50s called the magic number 7. You can be aware of what I just said, what you think about, the rate of your breathing, temperature in the room, right foot, left index finger, and if we hear crash, here goes our attention, something drops out. Well, we have a part of our brainstem called our reticular activating system, and one of its many functions is radar. So if you get married, whoa, you see everyone getting married. And if you have children, oh, it's like a baby boom. And if you're interested in a certain car, there it goes again. Part of our brain's going doot, 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 doot. All right, so I had him externalize his values, and the easiest way I ever found that to do is ask people for a list of words. If you just at the top of your head, what's the most important thing to you? What words pop into mind? You know, like family, love, health, whatever. These are things that people often have. I clarified the values with him. We set some goals, turned that into a plan, tuned up his self-esteem a little bit, and 2 months later, he starts his own business, quits his dead-end job, and just like that, depression is gone. I can't believe how much depression, low energy syndrome just goes when people get clear about what they really want in life and go for it. You know, I had another patient who, she was stressed and overeating and not taking care of herself. And I said, well, what's really going on? And she said, my boss, I can't stand my boss. I'm stuck in this job. So I clarified her values with her, and she had family and education as very high values. And all of a sudden she realized that the reason she felt stuck in this job is because she was putting her 2 daughters through college. And in 3 years, the second daughter would be out, and that's it. She doesn't have to stay in this job. She could do anything she wanted after that. And just like that, the stress was gone. Just like that, the boss was not that big a deal. It was put in perspective. So control. This is what I mean by the degree of control that we feel over life, and this is where the book Life by Design came from. There's another aspect here, and that is, of course, people. You ever notice how a difficult person can pollute the environment? In fact, I started learning communication simply to just be more influential with my patients, to get them to make certain lifestyle changes and motivate them. But next thing I know, as I start counseling more and more people, I'm finding out there are different relationship issues and what's going on. And then teaching them the skills I was learning, and when they would implement that, whoa, suddenly, oh, there's changes would occur. So if we look at this as a personal health model, and actually you can use this model in so many places, and what you do is you make the hypotenuse whatever your goal is, whatever you want to achieve. And given today's talk, we're staying with health and well-being. And so what that immediately divides into is there's factors you can't control, but then there's always something you can control. And success in life is to recognize what you can't, but not to dwell on that, because you only have 7 bits of attention. Dwell on what you can't control, you feel miserable. But when you look at what you can control and you maximize it, you can make up for it. And you really can't compare yourself to anybody else, because let's face it, some people are going to bring in so much genetic strength, no matter what they do, they're going to have a pretty incredible health line. And some of us will have to work a lot harder to have the same. So let's take a look at a short history of medicine and how we got to where we are today. Let's go back to ancient Greece, and we have Galen in the 2nd century. And Galen, physician to Roman emperors, and he became the standard authority on medical matters. He was doing a lot of dissections, although not on humans. It was pretty much on animals. But as his works became the standard, Galen warned, quote, "If anyone wishes to observe the works of nature, he should put his trust not in books of anatomy, but in his own eyes. See for yourself." And then those words were somewhat prophetic, because what happened was his works became unquestionable truths for the next 14 centuries. But that was the Dark Ages. So let's fly forward into the Renaissance, where people are starting to question things. I think Galileo said, "We must look at what others have seen and see it in a new way." That was the attitude of the the Renaissance. So Vesalius, he started doing dissections on humans. If it was usually criminals who were executed, and he would go sneak out of the gate of the city at night and grab parts of the body and dissect it. And he felt that firsthand experience in dissection is essential for medical training. Well, as he started teaching, the city authorities would always brace themselves for a rash of body snatching right after one of his lectures, because all the students would want to see for their own eyes, as he urged them to do. In 1543, he wrote the 7 books concerning the structure of the human body, known more often by the Latin name, the Fabrica. But he knew what a stir this was going to make, because it kind of blew away a lot of Galen's beliefs or works. And in the foreword of his book, he wrote, "I am aware of how little authority my efforts will carry by reason of my youth," he was 28 at the time, "and the frequency with how I draw attention to the falseness of Galen's pronouncements. I am attacked by those who have not applied themselves, as I have done, to anatomy, and who now, being old men, are devoured by envy at the true discoveries of youth, and ashamed that they have failed to notice what I set forth." He had to relinquish his chair and burn his notes. But he had a good job. He then became the official physician of the emperor of the empire at that time. All right, flash forward another 100 years. We've got William Harvey, raised in England. He investigated blood flow, the heart, and the beating system. Galen had it completely backwards, thinking the veins were moving blood out. Harvey showed what it really was through experimentation, and wrote the anatomical treatise on the movement of the heart and blood in animals. And he also was aware of the stir that was going to make. Quote, "They," meaning his works, "are of so novel and unheard of character that I not only fear injury to myself from the envy of a few, but I tremble lest I have mankind at large for my enemies. So much does custom and doctrine and respect for antiquity influence all men." Fly forward. Before we do that, so what Harvey gave us is the scientific method as we know it today, where you observe a phenomenon, you make a hypothesis, guess at what might be going on, then do an experiment to test your hypothesis, and then conclude. It's the scientific method that is still being used today. Fly forward another 100 years, we have Edward Jenner. Now, smallpox was quite the scourge. 1/3 of all children who died before the age of 10 were killed by smallpox. 10% of all deaths in population, including adults, were from smallpox. They could find smallpox all the way back to Egyptian mummies. However, what was noticed at the time is if somebody got a mild case of smallpox, that they would survive, then they became immune to getting the serious one. He also noticed that there was something called cowpox, which was a relation to smallpox, but not that virulent, and that it seemed like milkmaids would never get smallpox and die. So he hypothesized that maybe this is like a natural form of a lesser smallpox, can be used for immunity. He did experiment on a young boy where he gave first cowpox, then exposed the boy to smallpox. The boy lived through it, no problem. Then a few months later, another big dose of smallpox. Imagine the litigation today on that kind of experiment. But he proved that there was immunity. Now, he didn't know yet about germ theory or any of that. That's still coming. But this is the beginning of vaccinations. He presented a paper, wow, this miracle, and the response to his paper was, quote, "A fellow of the society should be cautious and ought not to risk his reputation by presenting to the learned body anything which appears so much at variance with established knowledge and so incredible." There's a pattern here. All right, Let's flash forward another 100 years. We got Louis Pasteur, late 1800s. He finds there are microbes, proves a germ theory. He starts working with vaccines. He was working with chicken cholera. So they were exposing chickens to the cholera disease, seeing if they can create immunity. Well, he was taking a vacation. He told his lab assistant to expose these chickens while I'm gone, and he left. Once he left, his lab assistant thought, I could use a vacation, and he left. So those chickens never got exposed. When they got back, and they had that broth of cholera that they were going to use, and they gave it to the chickens, they found the chickens just got mildly sick and then recovered. So they realized that it had gotten spoiled while it was sitting around. It was no longer virulent. The assistant was about to throw it away, and Louis Pasteur said, wait a second. Perhaps there's something that can make something that's virulent less virulent, thereby using it as a vaccine, and that's what he found out. And this was big because, all right, Jenner found something natural in nature that related to smallpox, which is a big step. There may or may not be something. What Pasteur discovered is there's a way to take a disease, make it less virulent, so that you can use it as immune. And he's the one who termed the name vaccine, which was related back to Jenner. He reported that to the Academy of Medicine, and what happened was he was literally attacked by an 80-year-old physician who lunged at him and subsequently challenged him to a duel for, quote, making so much for all this fussing with chickens. Flash forward another 80 years, and everybody knows more doctors smoke Camels than any other cigarette. Except for the 20,679 physicians who say Luckies are less irritating. Bottom line is today's beliefs are tomorrow's insanity. What seems to make sense, and there is a pattern in medicine where somebody really thinks outside the box and even tells others, keep thinking outside the box, and then it becomes, boom, written in stone and solidified, and everybody resists making change. It's been a continuous pattern in medicine for centuries and centuries. And if you just think about this on human terms, it makes sense. You look around and you think, hey, there's a lot of smart people here. They've been involved in this for a long time. They must know what they're doing. I mean, you see this pattern in a lot of ways. I remember in anatomy class, we had Buschhager, Professor Buschhager, and he had somewhat of a, not quite a stutter, but he would kind of do this and sort of, it wasn't really stuttering, but it was, there was something in the way of getting out the phrases. And so, you know, I taking notes, and he says, and that'll be a test Thursday. And he said, what? And I didn't hear what was going to be a test Thursday. I just heard sort of a phrase. I thought maybe I'd spaced out. And I'm looking around, and everybody's kind of writing, and I'm thinking, oh no, what am I going to do? And, you know, I didn't want to ask him, because if you miss something, he kind of would make a big deal out of you. But finally, you know, I had to survive. So I said, excuse me, Dr. Buschhager, test Thursday. What did you say was going to be on the test Thursday? And he goes, oh, blah, 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 blah. He let me live. Well, I get out of class, and 5 people surround me and go, thanks for asking. Boy, I can't believe what an idiot. He said test Thursday, didn't tell us what was going to be on it. I'll never forget, 25 future physicians in that room sat there and going, looks like everybody else knows what's going on around here. It's human behavior. It's human behavior, even among the smartest people. So let's get into modern medicine here. So we have back 1928 penicillin. In fact, let's take a detour here and look at this. It's a very interesting story. So we've got a Scottish physician. When he's not doing his haggis, he's studying different things. He's in London in a very damp basement laboratory, and he notices once again this petri dish has been polluted. Got fungus growing on it. There goes that experiment. But then he notices, wait a second, the bacteria that's supposedly growing in this petri dish is not growing around the fungus. There's a clear ring around the fungus, and he wonders, could there be something? And of course, what he discovers is penicillin. He got quite famous for that. His detractors said, oh, you were lucky. In his own defense, he said, you know, the fungus didn't stand up on the auger and say, excuse me, sir, I create an antibiotic, you know. He said, fortune favors the prepared mind. Actually, that was Louis Pasteur. Fortune favors the prepared mind. However, we couldn't really make enough penicillin. It was March 14, 1942. The first patient with streptococcal septicemia was treated with penicillin, and it required half of all the penicillin in the United States to treat one person. Not that there was a lot. There weren't very many doses. About 7 months later, there was about 10 doses worth of penicillin. Well, a war was on, so the Army had a plan, and in 1943, they do a worldwide search. Can we find a source of penicillin? And yes, they did, and it came down to a moldy cantaloupe in Peoria, Illinois. That was a perfect median, and by the invasion of Normandy, a year later, we had 2.3 million doses of penicillin available. By the end of the war, in 1946, we had over 600 billion doses. And this ushered in really a new era. See, what that enabled us to do with antibiotics is suddenly not only take care of bacterial infections and bacterial diseases, but it also enhanced surgery. Because more often than not, the patient died not from the surgery, but from the septicemia that happened after the surgery. And of course, with World War II going on, you had a lot of people to experiment on. It was estimated that about 15% of all American soldiers who were wounded and would have died did not because of having penicillin. 15%. So we flash forward a little further. Now we enter the age of the 50s, and surgery starts becoming blossoming, and you have to, it's this incredible miracle, the amount of trauma we can experience and yet still recover from. It's absolutely positively amazing. There's also sometimes the removal of troublesome body parts. Not always a good idea, especially when it's done without trying to do something preventatively up front. On the other side, we have antibiotics, taking care of bacterial infections, and we have the magic bullet mentality. Now, that magic bullet actually goes back to Paul Ehrlichman, who was a German physician in the late 1800s, Pasteur era, and he was really focusing on chemicals that could kill bacteria. It was the beginning of chemotherapy, but looking for agents that wouldn't hurt the patient but would take care of the bacteria. And he actually termed magic bullet. Well, now pharmacology really takes off in the 50s and into the 60s, and now it's take a pill. Naturopathic medicine, though it had been around since the early 1900s, faded into the background because drugs and surgery were going to save us. That was the attitude. If we compare 1900 to 2012, 1900, the top three causes of disease are pneumonia, influenza, tuberculosis, and diarrhea. All communicable diseases, which account for 60% of all deaths in the United States. Heart disease and cancer were 4 and 8, respectively. Since the 1940s, the majority of deaths is heart disease, cancer, and degenerative diseases. Now that accounts for 60% of all deaths. Now the other factor here is these communicable diseases would wipe out people so they wouldn't live as long. In 1900, the life expectancy is 49.24 years. As of 2004, life expectancy is 77.8 years. Survivorship to age of 50 in 1900 was only 58.5%. Made it that far. In 2007, it's 93%. So, welcome to the world of chronic disease. Because once you've taken care of the bacteria that are going to kill us, then we leave it to ourselves to kill us. And in fact, Surgeon General Koop said, we don't die, we kill ourselves. Because even in his era, the top 5 causes of death in people who were from about 45 to 60 years of age, when technically you shouldn't be dying, is all choices. One of them was car accidents, but you can make a choice, are you drinking and driving, etc. So even there can be a choice. At this point, half of all Americans have at least one chronic disease. It's the leading cause of disability and death, and it's the most costly. 70% of our healthcare dollars are spent on these chronic diseases. Now, the good news is they're preventable. The bad news is we're not preventing them. I mean, here's evidence-based chronic disease prevention, or as we like to say in the business, the EBCDP. Okay, 62% of coronary events are preventable by a healthy lifestyle. According to the Journal of American Medical Association, lifestyle change is the only intervention proven to reverse coronary artery disease. Same journal, 1 year of lifestyle intervention for patients with coronary artery disease not only improves the health, and reduces need for surgery, but as we start talking money, it is $7,000 versus $31,000 to $46,000, and that was 1998. 58% of all type 2 diabetes is preventable with lifestyle modifications. New England Journal of Medicine. I find it really funny about this whole thing about evidence-based. That in the allopathic profession now, we're evidence-based, as if everything else is not. No, the evidence is there. The awareness of the evidence might not be there, or the willingness to believe and experiment might not be there, but this is, again, typical in the history of medicine. Closed-minded, it must be this way. According to the Journal of the American Medical Association, New England Journal of Medicine, American Cancer Society, American Heart Association, chronic diseases such as diabetes, heart disease, and some cancers are considered preventable conditions, yet the current healthcare system shows little efficacy in preventative medicine. So this is where now the system meets where we are in terms of our health and well-being. See, our system is not healthcare. Well, what you guys focus on is, but it's disease management. When you get sick enough, then we manage the disease with very heroic and expensive methods. But it's not caring for health on the front end. See, this was a study in Washington with non-CAM health care providers, non-CAM. Only 16% said they were advised to eat fewer high-fat or low-cholesterol foods. Only 20% were advised to eat more fruits and vegetables. Only 23% were advised to be more physically active. It's all about, the system. What people believe, as well as the time frame. If a doctor has 15 minutes with a patient, if that, there's only so much you can do. To talk lifestyle really requires a lot more time and energy. I was brought in by a major healthcare organization, allopathic, in the LA area, although they're also in Florida and such, and they wanted me to observe their communication with physicians and their patients. So I was shadowing different physicians over the course of the day. And I noticed a few things. Well, one was the way the treatment room was set up was not ideal for communication at all. There was no place in that little room where the physician and patient could sit on eye level. One was on a table, one was on a chair. There's a computer on a swinging arm. Physician comes in, sits down at the computer, swings the arm. Patient is just sitting there, not even a moment of greeting or connection is there. One young woman had gotten burned on her back of her leg from a motorcycle, and she was concerned about scarring. And the physician told, well, maybe you will, maybe not. Most likely you will. And when we got out, I said, how come you didn't tell her to put some vitamin E on that? She goes, oh, I don't do those kinds of things. This is not esoteric. This has been studied and proven. I couldn't believe it. Then another physician that was quite opposite. He sat down with this guy, and the guy was having some kind of chronic headaches, and he started talking about possible drugs that could be used for this, although he pointed out that the side effects were really, really serious. But don't worry, we can somehow adjust the dose of this. And as he's talking more with this guy, he finds out he's a vegetarian, and he's eating all these grains and such. And I'm thinking, there's some kind of food allergy thing going on here, whether it's soy or wheat, especially because it's dominant in this guy's diet. But that's not even on the radar. Then he says, we better order a CAT scan for your brain and make sure there's not a tumor there. Okay, ching ching. And then, but what I was really impressed upon was while he's there, and the guy's only got 15 minutes with the patient, right? He says, well, you're already here. What else do you got going on? Amazing that he opened up. Usually my experience is it's kind of, let's stay focused, keep it closed, move on to the next person. Open it. Well, a back thing over here. Oh, when's it hurt? Yeah, I've been sitting working in a chair. All right, well, let me show you. It's probably this. And he was on the right track, that there was sciatica going on. And he brings up on the computer on Google a map or a picture of the body and the lower back, showing the thing. And then he starts going, all right, you want to do some stretches like this? Now, I'm starting to wonder two things. One is, why isn't he having the patient do the stretch? That would be a better thing to do right at that moment, although it's really a miracle that he's even showing him. And the second thing is, why isn't he referring to the chiropractor who's upstairs in their part of their whole group. Do they not realize what each other, that's part of their group. They're in the same office. They're part of the same healthcare organization. And then, even beyond that, he goes, and what else is going on? What else is going on? I was very impressed because he was totally the opposite of the first doctor, sat down and was with the computer like so. He was totally with the patient. The first doctor was concerned about getting all the notes in the computer while it was happening. He was going to put the notes in after the fact. He even printed out some things from, or at least that one picture. And I think he went through at least five issues that the guy had. And I felt he was really giving him a bag of gold in terms of things to do, but nothing was being written down for the patient. And I'm thinking the patient's going to walk out, and it was great, but where's it going to go? So then we go back to his office, the doctor's office, for the debrief. He goes, well, what do you think? And I said, all right, well, I think you did this really well. I think you connected with the patient. He goes, wait, I got to write this down or I'll never remember. Amazing, strange but true. Okay, so here's we have a healthcare timeline. Over here is when we're seriously sick on this side. Over here, we're in good shape. Over here, we're going the wrong way. There's a trend. Primary care needs to be prevention. At this point in time, still allopathically speaking, primary care is early detection. So we can manage the disease earlier. Early detection is not prevention. Primary care is here prevention, seeing the trends that are happening and intervening before we get onto this end of our spectrum. Now, specifically, naturopathic doctors are trained in prevention and early intervention in chronic conditions, which of course is going to reduce the premiums. If you don't get down to the far end, you're not going to be spending as much. The problem with the allopathic model is it's very reductionist. Right now, I'm on the board of the New York Association of Naturopathic Physicians. They're going for a licensing law there. And we're literally told by the medical society, what part of the body do you want? Because, all right, podiatrist, you got the foot. You can't have that, It's part of body. Now, this is the specialization that happens there. But that's an illusion. No part of you is separated from any other part of you. I mean, if you're depressed, you're going to lower your energy. There's going to be physiologic changes. I mean, I think it was 1985, Nobel Prize psychoneuroimmunology. As you think, so your immune system responds. If you think you're miserable and bummed out, your immune system drops. If you feel vibrant and happy and healthy, then your immune system is stronger. So a lot of times, because of that specialization, somebody takes care of one thing, but then people spring a leak in somewhere else. So the results of hormone replacement, the primary conventional treatment for menopausal symptoms, puts women at greater risk for heart disease, cancer, and gallbladder disease. From one thing to another. One study recently, 2009, obesity is costing U.S. about $147 billion annually. And the medical expenditures have doubled in the last 10 years. We're getting bigger and bigger, not just obesity, but also overweight. 58 million people are overweight, 40 million obese in this country. 8 out of 10 people over 25 are overweight. And what this is causing is 76% increase in type 2 diabetes, 70% of cardiovascular disease, 42% of breast and colon cancer, 30% gallbladder, 26% higher blood pressure. And of course, this all translates into these outrageous costs, which is basically cost overwhelm. Smoking kills 1 out of 5 people in this country, including non-smokers. 46,000 heart attacks for non-smokers, 3,400 lung cancers. And of course, smoking is a major contributor to most of our chronic disease that are causing problems. How many of you have seen the Time magazine article or read this yet? How many have not? How many wouldn't raise your hand no matter what I asked? Okay, you should read it. I was shocked. I had no idea. I thought really healthcare costs was about the fact that we weren't taking care of ourselves, but the hospitals make Wall Street seem like generous philanthropists. The medical industrial complex spends 4 times the amount of money lobbying Washington than the military industrial complex. Not-for-profit hospitals, which are not paying taxes, are reaping profits in the $500 million range. And it's by marking up costs into absurdity. 200, 1,000% marking up a cost, whether it's little things. The swab of cotton before giving an injection with alcohol, $7. Now, that's not even supposed to be there. That's called part of the facilities charge, but they've had to bill with all these charges because the hospitals are approaching it as a negotiation. It's going to be a negotiation with the insurance company, and if somebody doesn't have adequate insurance, then it's a negotiation of the patient. The author of this called them the Sisters of No Mercy, because that particular hospital group contracts with one of the most bloodthirsty bill-collecting agencies in the country, in Philadelphia. Definitely take a look at this. I was surprised. I always thought Medicare was basically the government just going tough. You got to take care of people, so you lose money on this. But no, I was surprised to learn to know. Medicare actually takes everything into account. What it's costing the hospital to do this. That will include the overhead. That will include everybody's salaries, staff, doctors, nurses. That will include every factor of the whole enchilada of what it takes to deliver this. Well, something that Medicare would pay $19 for, when they factor it all in, the hospital will charge $200 for. That's the markup that's going on there. So, I mean, how can we get around this? I don't know, unless there was a law that was passed about this, but then, of course, half the country will scream, oh, no, it's communism. But here's how we can get around it all, and that is back to our personal health model. There's things we can't control. Maybe we can't control what the hospitals are doing. Maybe we put that in that category. But there's always something we can control. And with CAM guidance professionals, people can maximize their health so they don't have to get into that bloodthirsty system. Example, in Washington, CAM users average $1,400 less in annual health care expenditures. Changes in lifestyle and stress reduction could save the U.S. $10 billion in reduced coronary procedures. Corporate health management programs have found that wellness shows a 26% reduction in health care costs, about $6 return on investment. Well, but is it safe? Well, let's take a look at safety. Here are malpractice claims. In 2009, for MDs and DOs, there were 1 million claims filed. There were 107,000 claims paid for malpractice at $34 billion. Taking the states where naturopathic physicians are licensed altogether, all those states, and looking over a 10-year period, there were only 17 claims that were filed and 0 payments out for malpractice. No jury found any malpractice in any case. How about satisfaction? Patient satisfaction, according to the study, 92% CAM versus 44% professional or conventional. Now, I mean, I remember how that was even as a student in naturopathic school. You know, we'd have an hour to spend with people, and people just talking and getting it out and having somebody feel like they're listening. You know, we students are feeling like, oh my God, I don't know what I'm doing yet. And yet there was so much healing that was happening just by virtue of having that connection, somebody taking time, explaining what to do, how to make changes, writing it down. Sometimes it's the little stuff that really counts big. Patients reported that 76% would definitely, 13% probably return to the same CAM provider. Patients reporting conventional care, very helpful, 17%, moderately 27%. Numbers are 56 and 26 for CAM. Let's go back to this one. Blue Shield Washington found that by utilizing NDs as primary care providers, so again, being at that front end of our continuum, would reduce costs by up to 40% and specialist utilization by 30%. Now, I find this to be a very interesting study. Now, this was done in Vermont, and not exactly a study, but there's a naturopathic doctor there, Bernie No, who created a wellness program. And the Vermont Automobile Dealers Association embraced that wellness program, and they found that they saved $1.5 million in direct and indirect medical costs just in the first year of that program alone, or $1,800 per employee. What were they looking for? Well, there was a drastic reduction in health factors, 36% reduction in hypertension, 16% in high cholesterol, 35 in multiple cardiovascular risks, 17 reduction in smoking, 21 reduction in physically inactive employees, and 25% reduction of excess stress. And what that translates to in healthcare costs is the direct costs were a 4.6 to 1 return on investment. The indirect cost, 16.5 to 1. When you put it all together, $21 were saved for every dollar invested in the program. And, you know, the worry sometimes, though, if you have CAM, that there's going to be so many more claims. Only a 0.2% increase in per member claims cost compared to the national average that year of 7%. So, you know, once again, it really comes down to this. What can we control, and doing something about it. Any questions? Yes.
I sometimes wonder that when I'm an agent, people ask me about alternative care providers that are maybe a little bit more motivated than somebody who doesn't ask for that. And how do you feel about that? Is your patient maybe a little more motivated because they know they're going to have to do things that are in their own control, like, you know, exercising more, maybe changing their habits, monitoring what they're eating?
Well, to a degree, there's some self-selection. The patients who tend to go to somebody, especially on their own. Now, when I first started in this business, it wasn't insurance. Nobody was paying for naturopath. So it was all so-called cash practice. So the people were definitely motivated. They had tried everything. So that certainly is one factor. With people who are coming into it cold, it's hard to say. I think then it's the influence of the person's ability to communicate, who's talking to them about the advantages. Again, you know, if you look around at medicine and all this money and all these buildings and all these smart people, genuinely smart people, with genuine miracles happening around there, okay? I mean, surgery and prosthetics and trauma, it's miraculous. A lot of the drugs are miraculous, but they're overused then for things that really don't work. So it's natural to think, well, everybody must know what they're doing. And that was something that was pointed out in the Time magazine article. Somebody finds out they have some serious illness, they go to the hospital, they're not shopping around at that point. They don't know the difference in one thing or another. He gave an example of a guy who found out he had lymphoma. They fly from Ohio to Texas, the MD Anderson Hospital complex there, because he's got to get this wonder drug, a shot from this wonder drug. The hospital won't let him in until they pay $49,000 up front. They're going to be charging $18,000 for this one shot. What they didn't tell them is the drug company actually has a charity program for people who can't afford it, and you can get this drug for free or for a few $100s, because it really costs the drug company $300 to make this. Right? Now, he found that out after the fact from his physician in Ohio when he got back. But the hospital wouldn't tell him that, or wouldn't even do anything until he had these. So, I mean, but when you're in and then there's a bill that's over 340 pages, line by line by line, and his wife said, I'm overwhelmed. My husband is dying. Last thing, I'm not going to be going through a bill that I don't even understand. So I think you have to address the fact that the scientific evidence that is there, and then the path that is clearly there in terms of chronic disease, where it's going. It's not a cure. It's disease management. Yeah.
I guess one comment I would make to Kathy's question is the Vermont Automobile Association,
Yeah, that's right.
That wellness program. And automobile industry is not a high KIAM profile population. So they're not necessarily predisposed to KIAM, but they have these remarkable results. So yes, people do self-select into KIAM services, but if you have a KIAM wellness program imposed on a population, you can still have it.
Back in my early days of practice, I had plenty of MDs who were referring to me. But that's because I established a relationship with them and they knew what I was doing. And in fact, in licensing, and I've been involved for quite a while, I was president of the A&P and vice president 3 years and like 7 years on that board. We found that initially medical doctors are skeptical, but when they hear about the training and they realize what we're focusing on, they realize in that spectrum of time, we're not really competing with them. We're focused in a different area, and they are not usually the big obstacles. The big obstacles are people who are doing various things, nutritional counseling or whatever, who fear that they're not going to be able to do that anymore if a licensing law. We'll come back to you. There was one, or well, yeah, go ahead.
Well, there is one insurance carrier in the state that has peeled their benefits back repeatedly, and one of the things they've kept intact is their alternative care benefit, and really promote and champion that. And they have identified the target audience that they want to attract because they understand the results associated with that target audience, which makes complete sense from my standpoint. And I feel like our younger generation understands that, but what there is in Portland is a disconnect between providers and alternative care providers working together. And I'd love for you to discuss how we can champion that cause, or patients can champion their cause to work more closely together.
Well, I think that physical people have to get together. Like going back to healthcare partners in LA. That doctor has to talk to that chiropractor who's within their own. This isn't even a group. This is not like a CAM group. This is an organization. These doctors are employees of this organization. They're in the same thing. They need to understand when to refer to each other, what they do. It's about communication and getting to know people. That's what really has to happen. There's I was going to bring it a printout, but I think I have a slide. It's a little long. But let me read this to you. Naturopathic physicians are the cornerstone of primary care at our Old Town Clinic. This is the MD medical director of Central City Concern. Spanning both allopathic and naturopathic training, our naturopaths are able to care for many of the bread and butter conditions we see at OTC, such as diabetes, hypertension, and depression. But they also care for many of the conditions that our general internists often shy away from, such as fibromyalgia, metabolic syndrome, chronic fatigue. Right now in New York, the medical side says, we don't want you to diagnose, because that's their thing, diagnose. And once you have a diagnosis, then here's the official treatment plan. You have X, we do Y. It's very methodical in that. And in these areas, there is no methodical thing, so a lot of doctors will shy away from that. The holistic approach, which NDs are trained in, makes them uniquely suited for the biopsychosocial model of healthcare, whole body. That is so effective for our patients. Additionally, many of our patients have been traumatized by traditional Western medical environments. They would never come to see a regular doctor at all, but will come to see a naturopath and receive care that is suited to their own backgrounds and context. And as you can see from the attached graphs, which you can't see, our NDs perform just as well, and in some cases outperform our general internists on standard quality of care measured. What is that? Towards your question.
Well, I find it interesting about the healthcare reform going on and all of the changes that are happening really don't get to the root of changing people's lifestyles and really trying to grab on what's driving all the costs. But a lot of the health plans and even medical groups in town are trying to promote wellness, and they're saying, our doctors are going to ask about physical activity at an annual visit. And I'm wondering how much they've tried to incorporate people like you or people from your profession who have, kind of a track record of having worked, if they've really engaged in that conversation behind the scenes, and how much of it's just going to be kind of a fad or talk.
Yeah, I don't know how much of it. I don't think it can be a fad, because I think we're going off the fiscal cliff, and healthcare is the thing around the neck that's dragging us over the cliff. I get exposed in a different way, being so ingrained in the naturopathic community, and also on a political level, that I hear more of the stories of the integration rather than the.
And I deal with the consumer so much, and they're just not always engaged, and they're not always willing to change their habits. I think because of some of the things you've mentioned, that here's the pill that can fix it type of thing. And so I really struggle with that in terms of, as someone who's dealing with the consumer, what should I be promoting? What should my message be?
Mm-hmm.
The problem is the 16-ounce big gulp. Comment more than a question.
Thank you, Mayor Bloomberg.
Yes. The problem is that people don't want to take personal responsibility.
Right.
And you can't legislate that. You can't make people smarter than they are. And we all want the pill that's going to. I mean, how much of the weight loss things you see on TV say, you don't mention exercise. Just take this
Pill, yeah.
and it will solve everything. And so that's the biggest problem we have, is how do you get people thinking along those lines. Guys are traditionally bad about going to see the physician because we know they're going to tell us to lose weight, stop smoking, stop eating bacon for breakfast, things like that. And so we don't want to hear that. And so we all kind of stick our heads in the sand. And so, especially here on the West Coast, I migrated here from New Jersey back at the same time you did, and we didn't have any CAM or anything back on the East Coast, and still I don't think it's as popular back there. They seem to accept it more out here. And so I just think we need to try to find some way to change people's attitudes about it and healthiness in general.
That's true. It's about a change in attitude. Now, the doctor's going to tell you to do this, do this, do this, but they're not going to tell you how to do it. That's the missing thing.
Yeah.
And that's the link that the NDs, I know, can do, is what is the actual way to do it. I know a lot of my friends who have very big practices here in Portland have weight loss programs that are not only working for people who lose 30 or 40 pounds over the course of a few months, but then 80% are keeping it off because they've made really, if you do that program for so many months, you're going to change your habits. And you're also going to have suddenly an awareness of how, wow, food affects my system, how different I feel, how congested I do or I don't feel, how much energy I feel or don't feel. Suddenly you make the connection between what you eat and how it is.
Health friends think that you're going to go online and follow all these wellness and coaching guidelines and everything else, when the reality of it is people will not go online for those. You need a more hands-on approach, something where the physician is
Yes,
going to take
hands-on.
time. Yeah.
Absolutely. In fact, going back to that medical doctor who changed my life by telling me the symptom is a metaphor, he said the third-party paying system is the biggest obstacle to health and wellness in this country. If people had to pay for it themselves, they would be a lot more discerning, and they'd be a lot more careful up front about what they're doing. Yes.
Adding on to what this gentleman just said, the issue of personal responsibility for the consumer, but I'm fairly involved in my health and natural healing, but so many of my friends are overwhelmed by the information they're being given, both in the mass media, by traditional, big pharma, of, coffee's good, coffee's bad. This Mediterranean diet's good, the Southeast, whatever.
Red wine.
Yeah. So they
Drink a bottle a day, it'll help.
they're starting to feel like there's a conspiracy of too much information, and they just get frustrated. So I think that needs to come into the equation.
We're definitely in the too much information age.
Yeah, the average person just says, "Oh, to hell with it."
The medical doctors that I talked to, and again at that group in LA and some of the other groups, that one of the biggest things they are driven crazy now are by the drug commercials. Patients are coming in wanting the drug, and I'm really impressed with how they and it's funny. There's almost action reaction. Prior to that, you don't want to give the drug, but now that the patient's asking for it, now they're talking much more about side effects and how there's not really a permanent cure. It's very interesting to hear the difference. Jamie.
So you had mentioned the recent Time Magazine article. There's also a recent article in the New York Times Magazine about the food supply, and it kind of equated the industrial food complex with big tobacco, and how there was sort of a conspiracy to get people hooked on snack foods and Twinkies. I mean, like scientific research went into how can we get people to continue buying this food that's terrible for us.
Absolutely.
And I also recently read.
Excuse me, I bet you can't eat just one.
Right.
Was scientifically,
Right.
yeah.
And I read something recently where in the U.S., Kraft macaroni and cheese is orange, right? Because there's a dye in it. In the UK, they don't allow that dye, so it's not orange. And why do we want orange?
I don't know. I don't know why pistachio nuts were red either.
I think that's part of it. I agree with Rupert. I think we each need to take accountability for the choices we make. But sometimes those choices are influenced by the industrial food complex and where people live and their access to fresh food.
Yes, absolutely.
Yeah.
My daughter's was managing farmers markets and especially working on getting farmers markets to be approved for EBT programs so that poor people aren't buying junk food, but they're buying good food. And what happened was once the electronic age came in and food stamps went electronic, the farmers markets were immediately cut out because they don't usually have electronic there or internet connection. University of California, Berkeley figured out a system where you have one terminal and people come and they give you the food, they give the food stamps to that person, they give tokens. Tokens then are used to purchase the food from the farmers. Then the farmers at the end of the day come back and give in the tokens and then reimburse. So, I mean, there's a lot of us thinking about it. There's a lot of accountability, and it really comes down to the choices we make, independent of big farm, independent of the food industrial complex or the medical complex. If each one of us is taking responsibility, we are making a difference, and we're affecting all the people around us. And here's something that has affected you today, going back 68 years. My mother was a survivor of Auschwitz. This is her in the ghetto with her twin sister. This is my cousin Aryeh, one of the few kids who survived. He's now a world-famous social psychologist. Speaks 13 languages fluently, goes all over the world lecturing.
Did you wear those pants?
I'm going to ask him the next time I see you. Thank you. January 1945, the Russian front is advancing fast. The Germans are very fearful of the Russians. They're heading west towards British or Americans to be captured. At this point, my mother and her sisters are part of a death march. They take 1,000 girls, and they're bringing up the rear of this German retreat. And your job is, on a so-called rest break, to dig a ditch in the road to slow the Russian tanks down. Give you 2 weeks, they shoot you, no time to waste, but it's on this march she realizes her life is in her hands. And how she realized that was by giving up. One night, they stop the camp, she breaks down, starts to cry. German officer calls her over, "Was ist los?" She says, "I can't take it anymore, I'm starving, I'm freezing, just kill me, I just want this to be over." He tears his sandwich in half, he hands her half, and says, "Listen, the war is almost over. You will live, we will die. You can make it. Now, watch yourself. Now, I order you to go stand and guard in front of that fire."
Wow.
The next day, she wakes up and she has hope, and she sees things all around her that was there all the time, but she never noticed before. When they're going through these deserted German towns and the road bends in a crescent, there's going to be a blind spot when the guards can't see them. That night, when they stop the camp, she notices that there's many minutes at a time that there's not a guard around to be seen. There were 70 guards, there were 1,000 girls. At one of these moments when no one's around, she just got up, walked away, went down an alley, down another alley, down a street, finds a deserted house, scratches the frost off the window. This is mid-January 1945. And she sees a Christmas tree inside with fruit hanging on it. She breaks into the house, eats an apple, and before she can feel good that she's gotten away, she realizes she's left her twin sister back there, her other sister's back there, her friends back there. They'll think she's dead. This could be the straw that breaks the camel's back for them. Plus, they can't keep this up much longer. What's she going to do? She's already gotten away. And then she thinks, I could not live the rest of my life knowing maybe I could have done something. If I can do this once, I can do this twice. So she sneaks back, lets herself be captured with her sister and her friends. All right, here's the opportunities. We're all in this together. Next day they're marching. They scatter. This time she finds a barrel, waits until nightfall. And when she comes out, the first thing she's aware of is silence. And nobody's around. And that's when she realizes, I'm free. Just like that. All things pass. Walks into town. There's a sister, another sister friend, wonderful reunion. And they realize, okay, this is great, but we're freezing. It's January in Germany. We're hardly dressed. Let's go indoors. They go in the house. They find the place is decorated for Christmas. They find the table is set for 4 with fine Rosenthal china for the holidays, as if they're expected. They go into the kitchen. They found food already prepared. They just sat down to dinner. At the end of that meal, she looks to find hand-painted china. It was a Gulliver's own set before the war. Then she thought, nah, I didn't live to wash dishes. Threw the plates out the window. Went on to the next house. She said she always regretted not taking service for 2. It was Rosenthal. Now, I tell you this because perspective is what happens right between our ears, and we are always making choices, and we are making choices that are affecting others. We may never know that.
But the choice of that German soldier 68 years ago has now reached through time and touched you, and the choices you will make. And I have to tell you, I really appreciate more than anything to be with a group that's associated with the things that you're doing and the difference you are making in life. So I urge you to go forth and multiply, and when things get tough, remember, life is not a test. It's an actual emergency. Thank you and good luck. Thank you.